There's so much attention on concussions these days, and for good reason. They're very, very serious injuries. And one of the challenges with concussions is knowing when an athlete has fully recovered. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, the reason it matters that we know when an athlete has returned to normal is that we know that if a player, an athlete, goes back to play too soon before his or her brain has completely recovered, she potentially has a higher risk of another concussion. Plus, the next concussion may be more serious, more severe, more symptoms that take longer to go away. But how can we know if a concussion has completely recovered? Well, we can't really rely on athletes to tell us that their symptoms are better. We should certainly ask. But one, we know that athletes a lot of times will hide or deny the symptoms of concussion in order to play. There's so much pressure to stay in the game. They don't want to let their teammates down and their coaches down. So a lot of times they'll hide the symptoms of concussion. And we've heard of NFL players talk about doing that. That's one problem. But another problem is a lot of young kids, high school kids, may not really know what's normal. They may not think that the nausea that they're having is part of a concussion, or that the headaches, are part of the concussion, or dizziness, or whatever the symptom is, so they may not think anything about it. You could say, well, the doctor or the athletic trainer can do tests, can do, neurologic tests and thinking, cognitive tests, and certainly there's fancier tests than that. And yes, those can be very helpful as well, but those can potentially miss symptoms or miss signs of a mild concussion or minor concussion. Even though we've gotten away from the severity, it's still a concussion, you could in theory still miss that. So what's really important is that we have sort of a neurologic profile, a neurocognitive profile on an athlete at baseline. And that's where this idea of baseline concussion tests comes from. There's a number of them. IMPACT and Axon are some of the bigger ones. But basically what this is, and it's usually done in a team setting. So every athlete on a team at the beginning of a season will take this computerized test, and it creates a profile, neurologic ability, cognitive ability. There's a variety of different things that it tests. So you have a baseline. And then if an athlete gets a concussion, then you repeat those tests at various points and compare the scores, compare the functioning to basically determine when an athlete's gotten back to normal. And a lot of times it's surprising, even though the athlete may say, hey, I feel great, I feel completely normal, and the neurologic tests check out, basically those neurocognitive tests may not be back to normal. So it can really detect subtle changes where an athlete's brain hasn't completely gotten back to normal, and that can be really important. So I think athletes in all contact and collision sports need to at least have one baseline neurocognitive test. You could argue maybe you don't need to repeat it every year. I know there's some variability there in opinion, but I think at least having one baseline relatively recently is really important so that if you do suffer a concussion, the doctor has something to compare to. Now, there's one thing I do want to point out that's really important. Just like I said, we know athletes will hide the symptoms of concussion. We hear these stories of athletes that intentionally try to do badly on these tests so that when they suffer a concussion, they get back to normal quicker because their baseline is abnormal. Now, those tests are becoming increasingly trickier to fool, but having said that, the kids want to take those tests very seriously. These are serious injuries. We need to do everything we can to treat them appropriately, and having an accurate baseline of brain performance is crucial to that. Okay, I'd love to hear what you think. Do you, if you play a team sport, do you have to take those baseline concussion tests, baseline cognitive tests at the beginning of the year? Or if you're a healthcare provider, what do you think about these tests? Do you have your athletes take them at the beginning of every season? I'd love to hear your thoughts. So below this video, share your thoughts with me. I'd love to read them, and I know people watching this video would love to read them as well. And if you know kids that play team sports, contact or collision sports, or maybe it's a parent that has kids that play sports, share this video with them. I hope it's helpful and gets them to ask, hey, can we get our kids tested before the start of the season? Now, if you like videos like this and you want more information on sports and exercise injuries, injury treatments and injury prevention, subscribe to my YouTube channel. I record a couple of these videos every single week, and I'd love to deliver those directly to you. And there's all sorts of other resources that I create, free resources that I create, whether it's videos like these or audio content or written articles that I share for free with my email list. So go to my website, drdavidgeyer.com, enter your name and your email, and I will deliver those on a regular basis directly to you. Thank you so much for watching. Again, I'd love to hear what you think about baseline concussion testing. Remember, subscribe to this YouTube channel, and I look forward to seeing you right here next time.